A hysterectomy is a common procedure that some women may need to help stop the pain, bleeding, or other problems. It can be done in several ways. A vaginal hysterectomy is surgery to remove a woman's uterus. The uterus is removed through the vagina. The uterus is an organ in the lower abdomen. It's shaped like an upside-down pear. The opening at the bottom of the uterus is the cervix. The cervix leads into the vagina. The top of the uterus is called the fundus. The two fallopian tubes connect to the uterus near the fundus. The tubes lead to the ovaries. Each month or so, one ovary releases an egg. It travels down the nearest fallopian tube to the uterus. During a vaginal hysterectomy, the whole uterus is removed. In some cases, the ovaries' fallopian tubes may also be taken out if the ovaries are not removed. The fallopian tubes are often taken out to reduce the risk of ovarian cancer. It's important to know that if you have a hysterectomy, you will no longer have periods and you will not be able to get pregnant. Your healthcare provider may recommend a vaginal hysterectomy for several reasons. You may have cancer of the uterus, ovaries, or cervix. You may have tissue growth called fibroids. You may have heavy bleeding during your periods. You may have endometriosis. This is when the tissue from the lining of the uterus also grows outside the uterus. You may have uterine prolapse, which is when your uterus bulges down into your vagina. These conditions can cause pain, discomfort, bleeding, and other problems. They may lead to future health problems. If left untreated, cancer can cause death. It is done only if other treatments will not work. What to expect? Before the operation, you may need to stop using certain medicines. You may be told to quit smoking or stop drinking alcohol. You may not be allowed to eat for a certain number of hours before the surgery. The surgery takes about 2 hours. You'll be given medicine to make you sleep. You might also be given medicine to keep you from feeling any pain from the waist down while you are asleep, and an incision is made in the vagina. This is to separate the uterus from the tissues around it. The uterus is removed through the vagina. The fallopian tubes and ovaries may be removed. If you have cancer, extra tissue from the vagina may be removed as well. In some cases, the healthcare provider may need to switch to an abdominal hysterectomy. This is done by making an incision in the abdomen. This may be done if he or she finds scar tissue inside the abdomen during the vaginal hysterectomy. You will stay in the hospital for 1 to 2 days after the procedure. You may be in pain and have cramps. You may have trouble urinating for a short time. You will have vaginal bleeding for a week or so after the surgery. It can take about 3 to 6 weeks to fully recover from the surgery. Each woman's recovery time is different. Check with your healthcare provider before going back to your normal activities. If your ovaries are removed and you are not close to the age of menopause, you will need estrogen replacement therapy. Be sure to discuss this with your healthcare provider. During a vaginal hysterectomy, your uterus will be removed through an opening in your vagina. It can take 3 to 6 weeks before you completely recover. You will never get your period again or be able to get pregnant. A hysterectomy is a common procedure that can help stop pain, bleeding, and other problems in the abdomen. If you have any questions or concerns, make sure to talk with your healthcare provider. Thanks for watching. Please subscribe and support us to learn more. Thank you.